Hello, this is Dr. Ezi on the second session in the pain station, and it's a critical care station in the MRCS part B. Okay, so in this station, sorry for the previous one, it was long, maybe 17 minutes, but this is a very long station. It is a very common station, and we try to explain the protocol of the critically ill surgical patient. That is why it was long. So now we are going to go to the next question by the examiner. He is going to ask you about the pain pathway. Okay, so pain pathway, the neurological pain pathway is important, and it is easy actually if you focus. The pain is received by the nociceptors at the periphery. Okay, and then it moves to the dorsal horn of the spinal cord. Okay, if we suppose that this is the spinal cord, okay, suppose that it is like that. Okay, so it comes to the dorsal horn, and it goes there through either alpha A delta fibers, or through C fibers. So the A delta fibers are for the sharp pain, and the C are slow, and they are for the dull pain. Okay, well, so from the nociceptors at the periphery, we went to the dorsal horn of the spinal cord. After that, decussation will occur, and through the spinothalamic tract, and spinothalamic tract is connecting the spinal cord with the thalamus. Okay, this is the reason of the name. Through the spinothalamic tract, it will go through the brainstem, it will go through the midbrain, and after that it will reach the thalamus. Okay, so the pain is the pain station is the thalamus, the main pain station. Okay, from the thalamus it is going to go to the somatosensory cortex. Somatosensory cortex. Okay, and this is the process: nociceptors, dorsal horn of the spinal cord, spinothalamic tract, through brainstem and midbrain to the thalamus, and then to the to the somatosensory cortex. This is the pain pathway in brief. Okay, so we will go to the next question now, and okay, I'm getting the color now. Well, so the next question will be about the pain scoring systems. What do you know any pain scoring systems? Okay, and I will tell you most of them, so you can remember many. Okay, under the stress of the exam. So number one, there is a one called verbal rating system, or verbal numerical system or scale. Okay, it is the VRS. Fine. So this is classified according to this. And 0 means there is it absent, no pain. Okay. 1, there is a mild pain. 2, there is discomfort. Okay. And 3, it is a distressing pain. Okay, and finally 4, it is excruciating. Okay, so this scale is from 0 to 4. You want to know this, it is very important, and this is the first one. Okay, well, next, the second one is known as the numerical rating scale, or they call it MRCS. Okay, so the numerical rating scale is also in numbers, but it is from 0 to 10. Okay, here there is no pain, and here there is in 10 this is worst imaginable. Okay, fine. So when they tell you that according to the numerical rating scale of pain here, his score is 5, for example, this is a moderate pain. Okay, 6, it is a moderate pain, and then you are going to this will be more severe. 2 is maybe mild to discomforting, and so on. Okay, so it is from 0 to 10 this scale. We will go to the next one here, the third one, and third one is called VAS, or visual analog scale. All of them are scales, as you see here. So a visual analog scale, this is a direct question. It starts from, do you feel pain? No pain. Or to can you just tell me about your pain, or describe it? This from the history. He tells you, for example, it is worst imaginable again. Okay, so from no pain to worst imaginable, no numbers here, it is just description. Okay, the fourth type of scales, pain scales, is the functional assessment, and this is also from the history. Okay, functional assessment. And in the functional assessment, you ask the patient, for example, if he can move or not. If he tells you that I cannot move, this means that the pain is severe. You ask him, can you cough? And he's post-operative, like this patient, most probably he's feeling severe pain in the post-operative side, okay, or at the operation site. Well, these are the main. There are others that I will mention to you here. Okay. There is a one called Wong, Baker, facial pain rating scale. Okay, this according to the how the patient's face look. Okay, well, so you have many faces there, and you are scoring according to them. The final one that I want to mention to you is abbreviated by WILDA. Okay, WILDA, and this is a full history scale. Okay, so this WILDA is an abbreviation for the description of the it's in words. First of all, this for W here, and these words will describe the intensity. Okay, for the I, and they will describe the location. It is a history question that will give you an idea about the pain. For the L, location, the duration is for the D. Okay, and finally the A is for the aggravating or alleviating factors. Okay, alleviating factors. So these 6 will be fine. You will not need to mention them all, but you want to know them. Fine. So this is a brief about these pain scales. The final part that I will take in this session is that the examiner is going to ask you about how will you manage the pain of this patient. We are speaking here about the management of the patient's pain in this scenario. So he has severe pain, and he has some drugs that are mentioned in the scenario, codeine and paracetamol. So how are you going to do? As we mentioned before, you did A, B, C, D, E protocol, or critically ill surgical patient protocol is applied by you. Second to that, okay, you are going to assess the severity by one of the scales above, the severity of pain. Okay, in the second step. The third step, actually, you are going to do one of two things. Okay, the first thing that you are going to do after assessment is, if there is a pain team, you are going to consult the pain team. Okay, if there is no pain team, you are going to give analgesia. Okay, this is a you are going to consult only. Here you are going to give analgesia. Okay, but you are going to do that according to the WHO later. Okay, so your treatment to pain will be, after I do A, B, C, D, E, or care for the critically ill surgical patient protocol application, I'm going to assess the severity of pain according to the scales mentioned before, and I will either call the pain team if it is there. If it is not there, I'm going to give analgesia according to the WHO pain relief later. Okay, well, now we are going to go to the next questions. He is going to ask you, do you know anything about the methods of treating the pain? Okay, methods of treatment. And the methods are divided into two categories. The first category is that there are some non-pharmacological methods, and there are pharmacological methods. In this way you will look professional. Okay, anything can be divided into categories. Please divide it, and this will give you more marks and save you time. And pharmacological methods. Okay, well, so non-pharmacological methods include preoperatively explanation and education of the patient. Relaxation is one of the methods that are used. Hypnosis also is a good way. Okay, and cold and heat for the traumas and these. Okay, you can also use splinting of the wound. All these are non-pharmacological. Okay, so the pharmacological methods are done according to the WHO later. Okay, so this is the answer for this question. Fine. Okay, I will see you in the next session now.